I'm officially introducing Denise Johnson, who is a public health educator with the New York City Department of Health and Mental Hygiene. And today, Denise is going to talk with us about falls prevention for older adults. And without further ado, I would like to hand it off to you, Denise. Thank you for being with us today.
So thank you so much, Lori. Once again, everyone, welcome. Good morning. Once again, I am Denise Johnson, public health educator with New York City Department of Health. Hopefully everyone is doing good today. And today we will focus on falls prevention for older adults, staying safe while staying at home. So welcome everyone. So at the end of the presentation, I will allow you to have time for all your questions, comments, concerns. So by the end of today's presentation, you will know the risk factors for falls, how to prevent falls, ways to make the home safer, and how to locate resources or tools for prevention. So last month we did have Falls Prevention Week that was in September. So today, if you didn't get a chance to attend any presentation or get any awareness about falls prevention, today we're going to look at that. So, just before I go into this diagram, as we know, with the pandemic, when it started, a lot more older adults were staying inside. We were all mandated to stay inside, and with older adults living longer, you want to make sure that you are living independent. You want to make sure you're able to do this by avoiding falls, because if you could end up falling, you can end up in a nursing rehab place, and then your independence is now taken away. So because older adults and they are living longer and they would like to live independently, you want to avoid falls, because among older adults, nearly 300 falls can happen per year related deaths from these falls. Also, every year, falls for older adults can result in hospitalization. So as you see here on this chart, there's nearly 17,000 hospitalizations as the result from falls. And a lot of these falls happen in the home. And also about 46% of these fall-related hospitalizations can end up a person being discharged to a skilled nursing facility. So as you look at this, falls are a major threat to older adults and to their independent living. So within New York City, we know that falls can lead to other injuries. So we're going to look at different ways to prevent falls. So although falls are common, they can also be preventable. So there are certain risk factors that makes the older population more susceptible for falls. So for instance, as you get older, your body changes. Your muscles become weaker. Your gait and your balance, you might have impairment issues, so you might need to walk with a cane. You may not be as steady as you used to when you're walking. Also, sensory impairment problems. So if you have problems with your vision, also your hearing. A lot of times people don't realize if you have hearing problems, that can affect your walking, because if you have let's say a problem with, if you had got water in your ear or some type of ear infection, that can throw off your balance and make you unsteady. Or sometimes you ever get ringing in your ears and it makes you feel dizzy and you go to walk, you feel a little unsteady, and then that could lead you to tripping. So those are some of those things, just, part of aging. As we get older, our body goes through these changes. As well as if, as you get older, we tend to have more medical issues where you might have to take certain medications. So if you take 4 or more medicines, sometimes those different medicines can have an interaction, which we will discuss a little later on, as well if you take psychoactive medicines, and those are medicines used for emotional or mental health problems. You might take certain medicines, depression, also having arthritis. So, as you get arthritis, your bones become weaker. Also, your joints become swollen. It may be more difficult to move. Some women, as they get older, they might have weakened bones, osteoporosis, um, diabetes, and even Parkinson's. So as you can see, having certain medical issues as well as taking medications can contribute to someone being a risk factor for falls. Also, environmental hazards inside the home. So if you have a lot of clutter inside your home, that can affect someone if you get up to go to the bathroom at night, and if you're tripping over different papers and clutter, or if you have pets, all of those things can be a risk factor for falls. And going outdoors, especially as the weather gets colder, and let's say if we have snow and ice, that can create a hazard, among itself. Also, going outdoors, you want to make sure you have appropriate footwear. So you not only want to make sure you have something comfortable, you want to make sure you don't have something too tight. If you are a diabetic, you want to make sure that you have the appropriate footwear, because sometimes if you wear shoes that are too tight, or even if they're too big, you go to walk, your foot is going to come out the shoes or sneakers, and that can create a fall hazard. So same thing if you wear shoes, and I know as we, especially us ladies, we still like to look cute. We might be wearing the shoes. Sometimes they could be pinching our feet. They could make our feet hurt. I know some people, I still see them wear the high heels. I'm not sure how they do it, but all of those things you have to be mindful, and especially as you get older, can contribute to falls. And then we also going to look at behavioral choices. And that just reflects to how we choose to interact with our environment. So let's say if you're a person, you like to go out and have a drink, you just need to be mindful of how much alcohol you're consuming, because if you have one too many, that can make you tipsy. So imagine if you get up and go walk, then if you had too much to drink, that can contribute to falls. So you just have to be mindful, like I said, the choices that we do behavioral. Also, some people have a history of falling, so that puts them more at risk, especially if they have fallen in the past and they are prone to that. So if you know you have that history, you want to make sure that you take precautions. So if that means that you feel like you're about to fall, maybe you need to sit down. Or if you have to walk with a crutch, a cane or a walker, you might want to make sure that you use those items to help you. And also, you might also want to wear alerts. They have the bracelets or sometimes the necklace, just to let someone know that you are more prone to fall. And if you go out, you may need a buddy or a home attendant or family member who can escort you to different places. And then there's also the fear of falling. There are some people who have that fear that maybe they had a fall before. So now they have that fear of going out. And what happens is now that person is just sitting home in their chair, and they don't want to go out because they have that fear they're going to fall. But now that's going to do the opposite, because now you're just sitting at home, you're becoming a couch potato, and guess what? You're not using your muscles. So now that's going to make you become weak. So you want to make sure that you do remain active. And so we're going to look at those things a little bit more in detail. But these are some of the things that put people at risk for falls. Now, the good thing is, like we have talked about falls, and however, they are preventable. So one of the things you can do is you want to keep your home safe. You want to make sure that you do manage your medication, have your vision and hearing check often. And last, you want to make sure you do remain physical active. So these things can help prevent falls, and we're going to look at each one of these areas a little separately. So in helping to remain keeping your home safe, you want to follow the 3 R's. So you have remove, repair, and reduce. So let's see what these 3 R's are talking about. So with remove, you want to make sure you get rid of any excess clutter that's around the home. So if you have newspaper, some people like to just keep papers and they keep mail, and sometimes these items just stock up, and before you know it, you have a whole pile of just excess clutter in your home. Sometimes Ian have pet toys. Like I know I have a dog at home and I just happened to realize this. I'm throwing away stuff. She has so many toys, toys here, toys there, and it's so easily just to get up and trip over a toy. So you just want to make sure, after you finish playing with your cat or toy or cat or dog, that you put those toys away. So this way you're not stumbling over them. Or even if you have grandkids that come over to visit sometimes, especially if it's your first grand, you might start to buy them all type of toys, and before you know it, they have so many. So you just want to be mindful of having a lot of excess items in your home that can be a tripping hazard. Some other things to be mindful that can be a tripping hazard is throw rugs. So if you do have to put down a throw rug, you want to make sure that you use like double-sided tape, so this way it stays flat. If you ever put down one of those throw rugs, you can see how easily, they don't stay flat and they just can, come up and rise, and you don't want to get up and stumble over that. And, believe me, it has happened to me. So, I can firsthand account that this stuff does happen. So you just be very careful. If you do have to put down a throw rug, make sure that it is um, straight and that you use something to keep it flat on the ground. So like I said, you can get double-sided tape, so this way that it does stick and it doesn't come up. So the next R we're going to look at is repair. So in this picture here, you see where the penny is, the tiles are coming up. So if you have uneven flooring in your home or on the stairs, you want to make sure you repair it. So I understand sometimes people don't have money to replace all the tiles, or so you might just want to repair the tiles that are loose, because you may not have money to repair the whole area, but if you have a few loose tiles, maybe you can just repair that area. So this way, if you go to walk or if you have a cane, it's not getting stuck underneath the unloose tiles. Anything to prevent falls. Also, the third R is reduce. So you want to reduce wire or cable cords. So as we look in this picture on the top, you see there's a lot of different cables. And I know today, as we get more and more technology, there's more and more things to plug in. So if you do have to have wires, you want to make sure you keep them close to the wall. Sometimes you can put them behind something, so this way it's not out in the front somewhere where you can get up and trip. And also you want to make sure that you don't put all the cords underneath a rug or a carpet, because now that can be a fire hazard. So you just want to have them close enough to the wall so it's not out and can be a tripping hazard. If you do live in a place where there is stairs, I know a lot of people today might live in an apartment and may not have stairs. And something I just like to remind everyone, even if the stuff I inform you today doesn't apply to you, you might know someone who can benefit from this information. So if you do live in an apartment, or if you live in a home, or you know someone that lives in a home, what they can do on the stairs is paint a contrasting color on the top of the edge of each step. So this way, if you have to go up and down, you are able to see the steps. Sometimes some people like to use strips that they can put down where during the night they are they glow in the dark, so this way you can still see yourself. If you're going up and down, you don't want to turn on a light, or if you have a flashlight, they will be bright enough so that you can see. Also, in the last picture, you see there is a lady, she's standing on a step stool. So you want to avoid using a step stool or standing on an item that has not, number one, this here, you don't know if this would hold her weight. And you can see from the step stool, if she steps any further, it looks like she would fall. So you want to make sure that you avoid using furniture or items not intended to be a step stool. And if you have to use a step stool, you want to use ones that have handrails. And if you do have items that you constantly use, you might want to put those items at a lower level, somewhere where it's easy to reach. They do have assisted devices that you can use that will grab the item. They have like little claws and it can reach the item for you. Or if you have to get something, maybe you can ask a neighbor or wait till a family member comes over and can reach high items. But if possible, you want to keep stuff at a low level where you can easily reach. And you don't want to stand on any type of item that has wheels, and of course, because then you will go rolling all over the place. You don't want to stand on a chair because that's not made for standing, that's for sitting, and it may not be able to hold your full weight if you're standing up to reach stuff, because you go to reach and the next thing, if that step stool slides, then you're going to fall and hurt yourself. So, like I said, if you do have to use a step stool, you want to use one that has handrails on the side. So these are the 3 R's: remove, repair, and reduce. So now we're going to look at some other ways that you can keep your home safe. So in your apartment, you want to make sure, or your home, you take steps to increase grip and support within the home. So in your bathroom, and the good thing is that some of the older adults, they already live in apartments that have been designated for older adults. So a lot of the apartments already have these items. But if you happen to live in an apartment and you don't have these items, you want to make sure that you get grab bars near toilet, in a tub, or in the shower. In this picture here, you can see, and these are grab bar supports. So if you're taking a bath, you need to get in and out, or if you're taking a shower, you have something to hold on to. You also want to make sure that you have anti-slip materials. So in the tub and shower, so you want to make sure you put down non-slip mats, decals. And this is all to, so they're slip resistant. Also, if you when you go to take showers, if you don't feel like you can stand up and you don't feel like your balance is going to be off, you can always get a shower seat, and that you just put in your shower. You can sit down, and this way, if you do feel like you're going to fall or something, you're sitting. Also, you want to make sure you use slip flooring when possible. And also something else you can do, like I said, if you do live someplace where there's stairs, you can attach non-slip rubber threads to the stairs or steps. And this is just to provide like some type of friction so that, when you go to step, it's not slippery. And also, if you do, like I said, live in a place where there's stairs, you want to make sure if there's any broken handrails that you fix any loose or broken handrails. And if possible, handrails should be on both sides of the stairs. Sometimes if you live in a house, that's not always possible, depending upon the size of their staircase. But if your room does allow, you want to make sure you have room on both sides. Some other things you can do to keep your home safe. You want to make sure you improve the lighting in your home. And a good example you can do is have uniform lighting in the home. So you want to see, like in this picture here, you want to have lamps on both sides of the bed. So let's say one light bulb has gone out, you're not fumbling in the dark, you could turn on the lamp on the other side. You also want to install lightweight curtains or shades to reduce glare. So you don't want the sun to brightly come in and, mess with your eyes and give you that glare, and then you get up and you can't see. Some other things you can do, you can install overhead lights, light switches at the top and the bottom of the stairs if you do live in a place where there is stairs. Good thing to also use, especially let's say if you have to get up during the middle of the night, you can use a night light, you can use lamps, you can use a flashlight. I know there's from doing this presentation, some older adults, they have told me that they go to the 99-cent store and there is they sell those little lights that you can click on and off. Some people pick those out and stick them all over. So that's different things that you can use. And if you do use a flashlight, make sure that you check the batteries regularly to make sure that it is working. You want to avoid using candles, reason being because that can be a fire hazard. So like I said, there are other alternatives. Like I said, you can use those little lights that you can click on and off. You can use flashlight and overhead lights. And you can usually find that at the nearest like 99-cent store. Although they're not 99-cent stores anymore, but you get my drift. So we talk about how you can reduce falls by maintaining your home. Now we're going to look at by managing your medication. So as I mentioned before, if you take a certain amount of medications, that can affect you, especially let's say if you take medicine, sometimes the medicines make you dizzy. So you have to be mindful. So what you want to do is ask your pharmacist or a doctor to review all your medicines, because you might have a medicine that if it makes you dizzy, maybe you can take it closer to your bedtime because now you're going to lay down. Sometimes it's not always possible to move certain medications. So that's why if you do feel that you have any side effects, that you do address it with the doctor and pharmacist. Maybe there's alternative medicine that they can switch and give you, because a lot of different medicines, they can react or interact with one another or have certain type of side effects. So it's important that what you can do is that you do list all the medicines that you take. And also you want to include any over-the-counter medicines, supplements, and vitamins. That is very important. So what you can do is get a medicine list card, or you can just get a piece of paper. And on this paper, you want to list everything that you take. What is the medicine used for, when to take it, how much to take, refill, and who prescribed it. Also, you can put down any allergies you have or any reactions to this medicine. And this medicine list card is just always good to have, because anytime you go to a doctor visit, rather it's your primary care doctor or a specialist, first thing they always ask, what medicine are you taking? God forbid if you have to go to emergency room, ambulance, they're going to ask you what medicines you're taking. So it's good to have. Some people carry it in their phone. But I always tell people what happens if you can't get into your cell phone, because that has happened, especially when you go to the emergency room. Sometimes you don't get good signals and then you're not be able to pull up everything on your phone. So the backup is to have it on a piece of paper, keep it in your wallet, and just list all the medications that you take. And like I said, it's important to also include vitamins, any supplements, because sometimes those vitamins or supplements may not mix well with your prescribed medicine. And sometimes those supplements can have a reaction with the medicine you're taking. Because like I said, certain medicines, they can make you feel dizzy. So that's why it's very important that you do discuss with your doctor and pharmacist so they know everything that you are taking. And on this list, medicine list card, you can also put down who to contact in case of emergency, their relationship, and very important, the pharmacy that you go to. A lot of times you go to the doctor, they'll ask you which pharmacy. So not only do you need to know the name, but their address, because sometimes, especially if you give, especially let's say if you say CVS, there are so many different CVS. So you want to make sure that you're picking up your medicine from the appropriate one. So that's little things that are very important to do. And like I said, managing the medications can help you prevent falls, especially if those medicines are causing you to feel dizzy. So another thing that you can do to help prevent falls is have your vision check. So you should have a comprehensive eye exam at least once a year. So that's very important. You want to make sure that you have your eyes checked. As we know, as we get older, sometimes our vision decrease. We don't see as well. You might get up the step and be like, oh, I didn't notice that. I bumped into something because, sometimes, like I said, as we age, our vision change, our body has different changes. And also, as you get older, you may experience glaucoma, cataracts, macular degeneration, and those things need to be monitored. If you have high blood pressure, you should have your eyes dilated at least once a year, or according to how often your doctor wants to test the pressure in your eyes. So it's very important that you do follow up with those things, as well as important to go get a hearing test. Because like I said, sometimes your hearing can throw off your balance. And a lot of times we don't put that connection of having a earache to like my balance. Because like I said, you can always have ringing in the ears, you can have vertigo, and those things can throw off your balance completely. So you can always, like I said, follow up with your primary care doctor and have them refer you to get an eye exam or a hearing test. So something else you can do to help, prevent fall is to remain physically active. So there is strong evidence showing physical activity can lower the risk of falls. So, you just want to make sure you get any type of physical activity. When you are physical active, it increases your muscles, your strength, flexibility, your balance, your endurance, you're increasing that. So just by, let's say if you have arthritis and you become very stiff and it's hard to move, when you add in some exercise, it increases your flexibility, your movement. As well, so physical activity helps control blood pressure. So it can lower your blood pressure if you have diabetes, if you're overweight, underweight, if you also have arthritis, osteoporosis, and pain. Physical activity has shown to help with that. So any type of physical activity is good. But the first thing I would like to say before you start any physical activity, you want to make sure that you speak with your primary care doctor. You want to make sure that you do get the clearance to start working out or doing any type of activity. That's very important because if you have any other health problems, you want to make sure you're not straining yourself more and that it's something that you're able to do. So that's always important first. So you can start out with any physical activity. Let's say if you were a person who's new to working out, you can just start off with walking, maybe 5 minutes until you can build yourself up. You can do stretching, dancing, and gardening is a form of physical activity. Cleaning, or for those who are not as very active but who would like to start working out, they even have where you can sit and fit. They have these YouTube videos you put on, and it just shows you how to sit in your chair. You might start with just moving your arms up and down, move your legs. And also, if you don't have dumbbells or weight, you can just get some water bottles and, fill them up with water. And now you're just lifting your arms. So now you're moving your arms. You're doing some type of activity. So sometimes it doesn't take a lot of money. You don't have to join these fancy gyms, but if you want to, but if you don't have the money, you can always start out small. Um, and this is, you want to do the physical activity. So like I said, you increase your strength and balance. If you're interested in joining gyms or classes, you can go to the different senior centers. They offer different exercise classes. You can also go to bfitnyc.org where they'll have, I think for older adults, they have like a discount to their different recreation centers through the New York City Parks Department. And there's also classes. You can always just Google on your phone or go to YouTube, and they have all type of exercise classes for beginners, intermediate, advanced. You can do yoga. So there's all type of classes you have. If you are a older adult, let's say you just had surgery, or if you're bedbound, it is recommended that you can get physical therapy in the home. So this way you're remaining active as well. Just speak with your doctor to see if you are, or your health insurance to see if you're eligible to have physical therapy in a home. Because it's very important that you do want to stay moving, stay active. And like I said, you start off slow until you build yourself up. And next thing I know, you might be running a marathon, but okay, at least not a marathon, but at least, you just want to stay active. So the next thing we're going to look at is something that home visitors can do to help prevent falls in the home. So what we have is a fall assessment. And with this fall assessment, I'm going to show you on the next screen. This fall assessment is something that if you, let's say you have family member, if you have a home attendant or a caretaker that comes home to your home to help you, they can look at this assessment, identify if there is any fall hazards, and work with the family to make the home safer. So here we have how to prevent falls, a home safety checklist. So with this checklist, it looks at different areas in the home to see if there is a hazard. If there is a hazard, then you look at ways that it can be corrected. So we won't go through all of them, but I will go through some of them. So in a bedroom, it says, is it hard to reach a light from your bed? So if it's yes, then you want to place a lamp or a flashlight close to the bed. In the bathroom, is the tub or shower slippery? If it's yes, then you want to place a non-slip mat or a self-stick strip to the bathtub or on the shower floor. So it goes to each area of the homes where hazards have been found, and it shows you how to correct that. Also on the back, it looks at free or low-cost home maintenance and repair programs. So I know I mentioned before in the bathrooms, you want to have grip bars. So if you don't have grip bars in your home, you want to reach out to your property owner to find out if you can get them installed. For things like showers, seats, stuff like that, you could reach out to your health insurance to see if they will cover it. A lot of times they will cover those items or offer some type of reimbursement. If you live in NYCHA, you would have to follow up with NYCHA Contact Center. And I will forward a copy of this presentation to Miss Lori. So if you don't get a chance to copy down some of the information, don't worry, I will forward it. And this way you can get the information. And like I said, some insurance will reimburse for certain safety equipment in the home. There are some organizations that they will do repairs for seniors. Some of them have like a fee. You can always reach out to New York City Department of Aging. They have a lot of different agencies that they can refer you to as well. So in event, let's say if you do happen to have a fall, I know we talked about falls are preventable, but what happens if there is a fall? So you want to make sure in case of a fall that you do have phones that are easy reach from the floor. I know a lot of times now everyone has cell phones. So if you do, it's good to carry the cell phone with you in event if you do fall. Also, if you do happen to have a landline in your home, you want to make sure that you keep it in low level areas. So you don't want to have it up on the wall in a high place. If you fall, you want to keep it low somewhere like on a table or something that's low. So this way, if you fell, you can pull it down and still be able to call for help. You want to make sure you keep a card with large print emergency numbers in case of a fall. So if you have to reach your physician, you can call 911, or if you need to reach the building maintenance or the super, you have their number, or if you have to reach a family member, you want to have those numbers already somewhere ready, available, in case you have to call them. Now, like I said, we talked about like if preventing falls, but what happens if you do happen to fall? So the first thing you want to do, you don't want to panic. You don't want to panic. We're going to show you and how to get up from a fall. And this is only if you are able to. You don't want to further injure yourself or hurt yourself. So if you're able to, the first thing you want to do is turn over naturally and turn the direction of the roll that you want to start to get up from. So that's the picture one. Picture two, and this is only if you can, you want to crawl to a strong, stable piece of furniture. So for instance, in this picture, we see a chair here. You don't want to use a chair that has wheels on it, because if you go to pull yourself, you're going to start to roll all over the place. So if you have something like a chair or a sofa, you want to crawl to that stable piece of furniture and slowly pull yourself up. So you want to approach the chair from the front and put both hands on the seat. So when you see in this picture, she rolled, pulled herself up. Yeah, she crawled to the chair and pulled herself up. Then you want to slowly begin to rise. So you want to bend whatever knee is the strongest and keep your other knee on the floor. So as you can see, she bent one knee, whatever one is stronger, she bent that one and kept the other foot on the floor. And then slowly you want to twist around in the chair. So if you're laying down, you want to crawl to a piece of furniture, that's stable, and then put one leg down, one up, and slowly twist around until you're able to turn and sit in the chair. And like I said, sometimes it's easier said than done. Um, you just want to be able to, if you're able to, like I said, crawl to somewhere. Sometimes, so if it's the sofa, you want to grab onto like the arm of the sofa and pull yourself up until you get in the chair or sofa. Sometimes you might have to just pull yourself and roll up on the sofa until you can get off the floor. Sometimes it's not always possible. So if you hurt yourself, maybe you can call for help until someone can come in and reach you. Because like I said, it's not always able to get up from the fall, but if you are able to, this is what they recommend how to get up from a fall. So to learn more about falls prevention, you can visit the Department of Health at www.nyc.gov/health/prevent falls, or you can just go to the Department of Health website and then click in prevent falls. You can always check out New York City Department, Parks Department. Their website is www.nyc.gov/parks.org, or if you're on the New York City website, you could just put in Parks Department, or you just type in Parks Department, and there you can look up different recreational programs. There's some New York City Shape Up classes on Facebook. So there's different ways that you can learn about falls, or if you want to learn about different recreational activities. So now we talked about falls. We have a little activity here. I just want you to look at this picture. It's called Messy Annie. And just to look at this apartment and see if, some of the hazards has been identified, but do you see any more hazards that are in this room? We'll go over it, but just, for yourself where you're at, if you could just jot them down and see how many you came up with. So I'll give you a few moments for that.
We've got no handrail on the steps.
Exactly. As you can see, there's no handrail. Okay.
We've got loose wires.
Over here, and the cat is creating a hazard playing with them. Okay.
What else do we've got? The rug. The rug has is coming up on the floor.
Yes.
Not lying flat. It's not taped down. We've got a coffee pot that's like on the edge of the table about to tip over.
Okay, so thank you everyone who answered. So we'll start with the ones in red that they already highlight. So as you can see, this is a fire safety hazard. So the carbon monoxide smoke detector, it's open. It looks like the batteries are out. There's a tripping hazard. So number one, as you can see, there's clutter on the steps. So you want to make sure that if you have to go up and down stairs, that there is no items on the steps. As you can see, as someone mentioned, there's no handrail. And something else, you can see this person has on slippers. So you have to be very careful if you wear these type of slippers, because it's very easy for your foot to come out of these type of shoes. So you want to make sure, another thing, that the footing that you wear is appropriate, because very easily to stumble or your foot come loose in these shoes. Now, something else, we have the medicine. So number one, if you look inside, there is a spider web. So this goes to show that this person may have expired medicine in there that they haven't taken, and it might be past the expiration date. So you want to be mindful. You want to make sure that you manage your medications. Also that you do close this, especially if you have young children that visit or if you have pets. As you can see on the table, they have some pills that they have just left open. They could mix up the pills. So you want to be mindful that when you finish with your medications, you put it back appropriately. as we see, this pot is bowl, it's running over and it's spilling over. It could get on the wires, so that could be a fire hazard. Let's see. Now I see Grandpa, he has on his glasses, but I see a pair of glasses on the table that may belong to Grandma. So if you're supposed to wear your glasses, you want to make sure you are wearing them, because let's say she's coming down these stairs and she doesn't see clearly because she forgot her glasses. So now she's going to trip over this box and books, and then she might slide on this throw rug here that is not flat down, as someone mentioned. Also, you see by the lamp, there is a lot of clutter. You want to avoid this because if these papers tilt over, guess what? You can trip on that. There's another hazard that they have a piece of clothing on the heater. So that alone could be a fire hazard. Also, there's like a unlit cigarette that someone was smoking that could easily fall on the rug and start a fire. The cat is playing with all these different wires. So these wires, you don't want to have them out like this. You want to have them closer to the wall behind where it's not easy access. So as you can imagine, I know we look at this cartoon, but I have spent many years as a caseworker going into different homes, and I have even seen worse than this. So these type of things do happen. Also, this person here, they might have been drinking as well. So if they drunk or had a little too much to drink and then forgot about the cigarette, so that goes back to your behavior. You just want to make sure that, you know, you are being mindful. So I think we covered the majority of the hazards here. So like I said, as you can see from the picture, how easy it is for a throw rug to come up. So as we mentioned before, you know, like I said, with age, sometimes it comes with falls, but the good things, falls are preventable. So, you know, you want to speak up to your doctor, remind them to have your eyes and hearing checked. You want to make sure that you keep moving. You want to stay physically active, have your eyes checked. Like I said, as we get older, our vision does change. And you want to make sure you make steps to make your home safer. So if there are any hazards, you want to correct that to prevent falls in your home. You can always go as well to the department, the CDC, Center for Disease Control, the government website, and they have something called STEADY, and that's stopping elderly accidents, deaths, and injuries. So they also have more information on falls prevention for older adults. This is if you would like to stay following us on the Department of Health, you can get connected. We're on Twitter, Instagram, Facebook, YouTube, and Tumblr. If you need to contact us, you can contact us at healthyhomesecp@health.nyc.gov, or you can also reach us at 646-632-6023. We answer calls Monday to Friday from 8:30 to 4:30 regarding environmental health issues in the home. If you don't speak English, we have access to the language line. After hours, you can leave a voicemail and we'll get back to you the next business day. And I just want to say thank you for allowing me to come and present. I know sometimes you may have heard fall prevention presentations in the past, but I always say it's just good to attend different ones because sometimes people bring different information to each different presentation or different view that you may not have heard before. So I just want to thank you for allowing me to come and present. So if you have any questions, concerns, feel free. Even if you don't have it now and it comes up later, please contact Miss Lori and she'll get the question to us. So I'm just stop sharing for now.
Denise, there
Okay.
are a few questions that came up during the presentation, which was great because I learned things for myself as well as for my mom, who I have helped. We spoke earlier before the presentation about how lucky some people are that they've got genes that let you fall without breaking anything, but everybody is not that way. So this
All
is a
right.
really, really important topic. So one of the questions was, is there a place to get that medication card? I know that you're going to share the slides and I'll send them out by email, but is there a website listed on that, on the slide, so that if someone actually wanted to print out the card itself and fill it in and carry it with them?
Okay, so what I can do, I can actually mail some to you. We have them in different languages. We recently got some in. I will have to double check because at one time Poison Control had it on their website. I will double check and get back to you, but in the interim, I can mail out some to you.
Okay, well, if there's a PDF, you could email that and then I could get that to people. Like, you don't have to actually put them in the physical mail, but
Sure, no problem.
whatever works. Okay,
Okay.
thank you. And then I guess we were also talking about the fact that today is National Mental Health Awareness Day. So you're with the New York City Department of Health and Mental Hygiene. So, you'd mentioned that people may be taking medication for different mental health issues that could cause them to fall. Are there any other things you'd like to say that aren't necessarily related to falling, but just to maintaining mental health as a good mental health as an older adult?
So sure. So the first thing, because a lot of times there is that stigma where people hear mental health and then people get shy, they don't like to talk about it, or they like, oh, I don't want to take medicine, or they'll feel embarrassed. So the first thing, if you do have a problem with mental health, don't feel embarrassed. You want to make sure you go seek the treatment that you need, follow up with your appointments. So if you do have to take the medicine, make sure that you do take it. Sometimes if you feel like side effects from it, don't let that deter you from take the medicine. Speak to your doctor. Maybe they need to adjust the medicine, or maybe you could take it closer, like I said, to bedtime. A lot of those medicines will make you feel sleepy. So maybe if you take it closer to bedtime, you won't feel the side effect as much. And like I said, also a lot of older adults, sometimes they become depressed because so many different things happen as you get older. Now you're in retirement, so you're not working as much. You may not have a lot of friends, or maybe because of different illness, you don't go out as lot. So you might be dealing with depression. So those type of things, like I said, don't feel embarrassed. Being mental health awareness day, you want to go out and, like I said, if you need to seek help, seek it. Don't feel bad or embarrassed about it. Doing nothing will make you feel even worse. So and like I said, if you do have to take those medicines, just be mindful how they might interact with other medicines. And yeah, if you have to get those appointments, if you need a caseworker or someone to help navigate, reach out to, older adult centers. Sometimes they might have a social worker, a therapist on site to help you navigate. And yeah, anything else you'd like to add?
Thank you. Yeah, I'd like to make a plug for the PSS centers, which do have social workers on site. And I think being around people and connecting with people is also a good way to get yourself out of your funk if you're in one, I would say. I've been asked to share for you to share the contact information again. Could you revisit
Okay.
that slide and then I'll type it in the chat and then
Okay,
people
let
can
me
also take notes. this was great, Denise. Very,
Okay.
very,
Okay, let me see.
you're getting thumbs up. Whoops.
Was it
Whoa,
this
whoa, whoa.
page here?
Well, maybe your contact information. All right, so we've got the email address for falls prevention, and then you had your own contact information.
Okay, yes.
Okay, so the phone number is 646-632-6023. Denise's number is 646-632-6477. And I'm trying to put it in the chat and my cursor is like not wanting to go there. Isn't that funny? So and you're open, you said, from 8:30 to 4:30?
Yes, Monday through Friday. After hours, you can leave a message. We'll get back to you the next business day. And if you have any environmental health issues, so if you have a problem with mold in your home, you have a problem controlling pests, if you have issues with indoor air quality, we could answer those type of questions.
Okay. Okay. And like I said, you'll be getting the slides very, very soon. So once again, Denise, last chance, folks, for any specific questions that you might have.
And just something is also a good time to get a bone density scan. A lot of times it's more prone with older women. Our bones become more brittle sometimes. So it's a good time if you feel you're a person that's prone to falls, you might reach out to your doctor and ask, can I get a bone density test? So those are just some things that you can do, especially if you're a person that's prone to falls, or just as a woman, or sometimes even men, they might need a bone density test just to see, God forbid, if they did fall, you know, are they more prone to getting a fracture or breaking something? And something else I always remind people, you know, another good thing to avoid falls, let's say if you're going out to an appointment and you're running late, and I have seen people run for the bus, let the bus go. There will be another bus. You can always call your doctor and say, I'm running late, because God forbid you're running for that bus, or, you know, or a cab or something, and you trip and
Guilty as
fall.
charged. Yeah. Guilty
Yes,
as charged.
I always tell people there will be another bus. Another thing, like if you have to go out when it's, let's say you have a doctor's appointment and let's say the weather is bad, you should probably cancel, reschedule. You don't want a chance going out, slipping and sliding on slush, snow, or ice. You know, I think your doctor would be understandable. I don't think they would want you to come out and slip and fall and then now have a bigger problem than what you intended to go to the doctor for. So, you know, in society and life, you know, there will be another bus. You can always reschedule, because a lot of times, especially in New York, we're always in a rush, haste. Sometimes I just let the people go because things can happen, you know.
Okay. Well, Denise, thank you. Thank you all of our active participants, and you stuck it out until the very end. So I think that says a lot about the quality of your presentation, Denise. Have a wonderful day, and stay tuned for what's coming next from PSS LifeU and the New York City Department of Health and Mental Hygiene. Okay.
Okay, thank you,
Have a great
everyone.
day,
Have a good
everyone.
day.
Bye-bye.